Hi guys. In today's video, you will learn about one of the health conditions that you should be worried about if your leg starts to hurt. Hi, I'm Dr. Hampton. I've been in the medical field for over 28 years, and I'm on a mission to help you achieve metabolic health. So when your leg starts to hurt, the first thing you want to think about is, rather that pain comes on suddenly or gradually over time. And when that pain is sudden, it's more likely that you have what we call a DVT, a deep vein thrombosis, which is when a clot forms in your leg. Now, if that pain comes on more gradually over time, it's more likely that you have a peripheral vascular disease, also abbreviated PAD, peripheral artery disease. And that's when the plaque builds up over time. And as you know, we use the term in medicine, atherosclerosis. Now, what is claudication? Because when you start to have that pain in the leg, you get what we call claudication. And what it is a reproducible ischemic muscle pain that occurs when you exercise or when you walk for a while. It also gets better when you take a break. So that's one of the things that can distinguish it from a clot, because clots probably won't get better when you take a break. We call it stable angina of the legs, which is very interesting because you're more familiar with that term when you get chest pain. And when you have plaques in the arteries around your heart, we call that angina pain. And just like with your legs, if you take a break, that pain tends to settle down as well. But there are other things that can cause you to have pain in your legs. Neurogenic causes like spinal stenosis, musculoskeletal things like arthritis, vascular things that can also, like venous insufficiency. We talked about DVTs and even restless leg syndrome, which tends to occur at night. But those are other things to think about. So as a clinician, I'm always thinking about everything that can cause harm. So when your doctor diagnoses you with this condition, they will order what we call an ankle brachial index, ABI test. It's kind of an ultrasound test. This could be done, believe it or not, in your doctor's office by simply measuring the arm or brachial artery pressure and comparing it to the dorsalis pedis blood pressure in your leg, as illustrated here. You don't really see it being done a lot in the doctor's office, but it is something that could be done in the doctor's office. So when we're measuring the ankle pressure, we blow up the cuff in that area. And the moment we hear that shh or rush sound, that's when the systolic blood pressure can be measured. Now, when I measure the arm blood pressure, I can use the same technique that we do for the ankle, but I can also do the traditional approach where we simply blow up the cuff. And when I hear the heartbeat for the first time, that's considered the systolic blood pressure of the arm. This has to be done, if you're doing it the right way, in both arm and both ankles. And then we use the higher of the two readings as the one that we go with. And this is really important. And then there's a nice little calculation you can see in the right lower corner where we determine what that number should be. And when you measure it, the normal range, as you can see, is 1.0 to 1.4. So if we see that the circulation is poor in the ankle reading, that's when that pressure is lower than we anticipate. And then you do your calculation, you get this calculation, and then you'll know what the result is. Now, what's really important is that we don't have problems with our circulation. So one of the things that you could imagine could be a harmful thing for your vessels in your legs is smoking. So not smoking is one of the first things you want to think about. Number two is antiplatelet therapy. You don't want those platelets to be too sticky and start to form atherosclerosis. So what you want to do is think about maybe an aspirin or a medicine called clopidogrel. Now, in the low-carb community, we're always fussing about statins because we know it can increase your risk for cognitive decline and diabetes. It is true, though, that statins decrease inflammation, and it has been shown that the symptoms of PAD, peripheral artery disease, are better with statins. I always tell patients risk-benefit, right? I tell people use medicines as bridge therapy. So if I have somebody in front of me who's suffering from this, we may do something like this temporarily. Many patients choose not to do it at all. So it's an individual thing that you discuss with your doctor. Of course, your blood pressure is a huge risk factor for this. So we want to have normal blood pressure. And then, of course, you have to exercise your legs. Just like with your heart, you want to exercise to make sure that you protect your legs. So there are other drugs that you want to be aware of. Many of you have heard of ACE inhibitors, any medicine that ends in pril, lisinopril, captopril, but ramipril is the only one that was studied for PAD. So if you are taking medicine, again, it's bridge therapy, this would be one you want to consider. And then there's this other medicine called cilostazol. This medicine can also be used to treat PAD, but is contraindicated in people who have congestive heart failure. So if you have that condition, make sure you're aware of that. Now, why do I care about all of this, right? Well, it's not just so, we want to prevent your legs from, not feeling good when you're walking. We also don't want to get the severe complications of having poor circulation. That would include things like gangrene and ulcers. And of course, if you get gangrene and things like that, we're now talking about the potential for amputations. And this hits me at home because in the communities of color, the amputation rate is way higher than other communities. So we really want to do all we can to prevent this. When you get to the point where it's severe, your doctor may order what we call the MRA, magnetic resonance angiography. And that type of test will allow you to see the blood vessels very clearly. And then you can work with either a vascular surgeon or you can work with an interventional radiologist who can work with your primary care doc just to figure out, what needs to be done. So the purpose of this video is to create awareness that if you start to have pain in your legs, take it seriously. It could be a clot, it could be those other conditions I mentioned. Certainly, it could be peripheral artery disease. And if you have this, there are things you can do. So make sure you work with your doctor if you're having pain. Don't blow it off. And I want you to do that because in order for you to be healthy and to exercise and do the things you like to do in life, you need to be able to move around and do it without pain. So I hope this video added value to your life. I hope that you are now aware of this condition in a way maybe that you hadn't been. And if you are, share in the comments what you thought about the video, like, subscribe, and share. And I'm on a mission again to help you achieve metabolic health. And we have to cover the entire body and all the medical conditions to get you there. So thank you again for coming to the Metabolic Health Docs YouTube channel. And until the next video, continue to be safe, be well, and continue to protect your nest.